familiar faces in there. Thank you for taking the time out to learn more about melanoma. You know, it's weird to say it's near and dear to our hearts, but I guess if I say you all are near and dear to our hearts, so thanks for educating yourselves. I mean, this is such a great opportunity. So for both of us, so I'm here to talk about inherited risk. So I have a little bit of a background in inherited cancers and DNA and all of that stuff. So I'm going to try to make this as non-scientific as possible, but you know, we're all a little bit geeky here. I'm sorry. Okay? Yeah, except for him. So we're going to talk about family today. I think family is, yes, a little bit more. Okay. So we're talking about family today, all right? Family members, you know, share many things. And many of you have asked in clinic, does this have anything to do with my family? Should I be concerned for my family? So we're going to go through some of that today, what we know and what we don't know, okay? So families share things like wonderful vocal cords, all right? A talent for self-promotion. A talent for getting elected, right? A talent for not needing to get elected. But what else do families share that have to do with melanoma? So there's a lot of things that families share. Sun sensitive, which is sort of lighter skin, but just any skin that's sun sensitive, this runs in families. Blue and green eyes, these are things that cause a higher risk for melanoma, and they run in families. Red hair, it's a slightly different pigment that's more sensitive to the sun. So red hair increases the risk for melanoma, and this runs in families. Freckling and a lot of moles. So these are the types of things that can run in families that increase risk for melanoma. So besides that, so, you know, as somebody who's really thinks about genetics all of the time, being in clinic, doing melanoma, you know, we started to kind of notice that a lot of people have family members with cancer. And really, the common thought about melanoma is, look, it's all sun, right? So, but what was interesting about it was when we actually looked at a whole year's worth of clinic patients to see, you know, how many folks who had a diagnosis of melanoma that showed up to one of our clinics had a family history of cancer, it was 3/4. That's higher than normal. So we were like, maybe there's something we need to look at. And we drilled it down. You know, maybe it's just, you know, luck, or just that, you know, breast cancer is common, prostate cancer is common. Does it really have anything to do with something that runs in families? And then we tried to drill it down and say, well, what about more than 3 cancers in a family? That's kind of unusual, right? And even then, it was still 30%, you know, almost 1 in 3. So we started thinking about this a little bit harder. So I'm going to sort of take you through some of the background and then get you back to some of our thoughts about this. And this is all work that's being done here in Cleveland, which is very exciting. For those of you who are proud of Cleveland, I hope there's a lot of you there. We're pretty proud that this is happening in Cleveland, okay? So, you know, we are not the only ones who are thinking about this. So there was a group in Norway that looked at twins, identical twins, and said, how often does the same exact cancer happen in identical twins? Because that gives you a kind of sense of, is this really genetic or not? And if you compare that to, does it happen in fraternal twins or not, you know, what's the difference? It gives you a little bit better sense. So when they looked at it, actually the most heritable cancers were melanoma and prostate cancer, which is a little bit, for those of us who are really familiar with cancer, we were a little bit surprised, because most people think that melanoma is related to sun exposure, you know, most of us involved. And I just want to tell you that everybody who has melanoma is beautiful. Just this is the way it is. I'm sure some of you agree with me. All the pictures look like this. So then there's this big question: is it nature or nurture? Does it have to do with genes that are inherited, or does it have to do with, you know, everybody in the family shares a love of golf, right, and is out in the sun a lot? or a love of swimming. So is it really sun exposure, or does it have to do with genes? So this is an interesting study where they kind of looked at, there's some known melanoma families, right? Some things that they're just melanoma in all the family, and they're related to specific genes. We'll talk about it in a little bit. But when they looked at these sort of high-risk individuals, and you look at where they live and how much sun exposure there is, so you can actually see if there's a lot of sun exposure, like in Australia, the chance of getting melanoma was much higher than if they lived in the UK, where we know it's kind of gray and cloudy. So I think the answer is a little bit of both. So genetics has something to do with it, but sun exposure also has something to do with it as well. All right, so how does this help? So people have said, look, why do I care? I have melanoma. I had melanoma, all right? And what does this really matter? Because I'm already getting skin checks, and my doctor already told me that all first-degree relatives should get skin checks because of that whole fair skin, fair hair business. So what does knowing, doing extra testing help me with? So to answer that question, well, sorry, reference to those of you who are younger in the room. What the real thing is, and again, only beautiful people get melanoma, just telling you here. So how does this help us and help our families? So I'm going to bring up this example of Angelina Jolie. Some of you may have read this in the news. I actually love this quote just in general. It doesn't have to do with families, but she was speaking about things that ran in her family. So life comes with many challenges. The ones that should not scare us are the ones we can take on and take control of. I think by being here today, you all are showing that, you have an interest in taking control of this, but with knowledge. So congratulations on doing this already. So Angelina Jolie, she was diagnosed with breast cancer a couple of years ago. Her mother died of ovarian cancer at the age of 40. All right, so her doctors correctly said, this looks suspicious. Let's have you tested for something that runs in the family. And what turns out to run in her family is a change in a gene called BRCA1. Okay, there's a BRCA1 and a BRCA2. It's not very common in the general population, a little bit more common if you're of Jewish heritage. And it increases the risk of breast cancer tremendously. So there is about an 80% chance, if you're a carrier, sometime in your life, and you're a woman, you could get breast cancer. And somewhere between a quarter to 40% chance, if you're a woman, that you would develop ovarian cancer. So this was a pretty big deal. And so when she found out that she was a carrier, what she ended up doing was, instead of having one breast removed, she had both. She thought about it for a little bit and decided she was done with having children. She had her ovaries removed. Okay. But what's interesting about BRCA in context to you all being here is that it actually does increase the risk of melanoma a little bit. Okay. 2 to 4% is not a lot. It's not a lot, but this was sort of the beginning of thinking about familial melanoma and how it might affect other organs, okay? So this is a different example. This is the first gene we figured out was related to familial melanoma. And you can see this is a family tree. There are 4 different people in this family of 8 that have some kind of melanoma. Okay, so that looks pretty suspicious. And in fact, this person has multiple melanomas. So if you see with a family like this, with a lot of melanoma everywhere, a third of those families are because there's this inherited change in a gene called CDKN2A. You don't need to memorize that. And it is also associated with pancreatic tumors. Not in this family. But the reason I bring this up is not, this is a pretty rare condition. But the reason I bring this up is, At the very first time the first person in this family was diagnosed, it was this person who at 27 had had 2 melanomas, but no one else in the family had melanoma at the time, okay? Because these 2 people were still in their teens, all right? And this person, they just hadn't, they knew that person had passed, but not why, okay? And then if you look, 20 years later, then that family tree becomes a lot more obvious. So one of these things about familial cancer traits to know is that family histories change as people age. So, if you ever have a question like this, it's always good to update your doc with changes. If you hear of something new that somebody was diagnosed with in the family. All right? Okay, this is not information you need to digest, all right? But this is just to say, these are the genes we know that are associated with melanoma. These are the ones that have families that look like the one I just showed you. Lots of melanomas everywhere. And there are some other cancers involved, but they're less common than having melanoma involved. That's all you need to know about this slide, okay? And then these are the ones like BRCA, like the change that Angelina Jolie's family has, where the melanoma part's kind of a small part of it, from the perspective of that gene or gene change. But to the person who has a melanoma and who has family members with breast and ovarian cancer, it's a big deal. So again, all I want to point out with these slides is to say, look, that one of the important things about diagnosing something that runs in a family is that there are other cancers involved, not only for the relatives, but for that person. So if something runs in a family, we're not just thinking about skin exams. We're thinking about other things. What kind of other things do we need to think about? Well, one is, so all of that was kind of the scary part. Now you can relax. But one of the first things to remember is when there's something that runs in a family, not every carrier gets cancer. So being diagnosed as a carrier is not a death sentence. It's not even a sentence for cancer, okay? If you look at BRCA, for a male, there is an increased risk for prostate cancer and for male breast cancer, but the likelihood of getting either of those is very low. 6% for male breast cancer, that's very low. I mean, it's much higher than the general population risk, but it's very low in general. And even if you're a woman, you can see these percentages are not 100%. So the chances of getting that cancer if a woman is a carrier, it's not 100%. It's not. There are plenty of people who are carriers and never know it in their lives. Okay, so that's a really important thing to know about familial cancers. Another thing that's extremely important to know about familial cancers is that, we are getting better at detecting cancer early. So if we know who's at high risk, we actually can start things that will diagnose the cancer earlier at a more curable stage. And for some cancers, we actually can do a decent job preventing. So if we take the example of BRCA, these are all the things we can do to catch the disease earlier. Mastectomy can prevent breast cancer, not 100%, but pretty darn close. Removing ovaries can prevent ovarian cancer, not 100%, but pretty darn close. And even there are drugs that actually decrease the risk of breast and ovarian cancer, okay? So that's another important reason to diagnose these things, because then we can take proactive steps to either prevent cancer or reduce the risk. All right? So even for this is sort of a summary, even for somebody who had melanoma, clearly we've already told them, have an annual and sometimes every 3-month skin exam, okay? But if there's a carrier, if that person is a carrier, then other body systems can be surveyed. With MRI of the breast or with a kidney ultrasound, just depends on which gene, okay? We can actually do surveillance in families who are also carriers. And an interesting thing we found is that for people who know they are carriers, they tend to be more proactive in terms of getting skin exams and things like that, versus people who never bother to check. All right, and then for people who aren't carriers, it's nice reassurance. It feels good to know that they're not a carrier. Okay. So just really quick to show you what genetic counseling looks like, because many of you are not familiar with this. A genetic counseling, these are some of our friendly neighborhood genetic counselors that work here, and these, for the most part, all specialize in cancer, actually. So what does it look like? It's a sit-down visit where they look at the person's medical history, because that sometimes matters. Draw out a family tree to see who's involved, who's related to who. And they do education, which genes are important, which genes aren't important. And sometimes you can go to a genetic counseling visit and they'll say, look, you know what, your family's not at high risk. And that's actually reassuring to say, look, a genetic specialist looked at my family tree and said, there's nothing to test here. It's not concerning. But sometimes they do recommend testing, and if necessary, that usually involves a blood draw. And then there's usually counseling afterwards. So what they'll do is say, look, this test is positive, and that means this. This test is negative, and this means this. So these are the results of genetic testing, just to familiarize yourself. So there's positive, which means there's an increased risk of cancer. There's a negative, which means the risk of cancer is not zero, but it's at the level of the general population risk. And then there's something in between, which is, we don't have enough information yet. And that's really considered negative unless proven otherwise. But this is the kind of thing a genetic counselor will step people through. And what's great is they do a lot of support. They'll make family letters. So if there is a positive result, they'll actually put all the information together that you would need to pass on to a family member. So it doesn't have to be telephone. Okay? Just really quick. So this is coming back to what do we know about inherited melanoma? We actually have a family melanoma registry here that is supported by one of our Cleveland families who generously donated to support this research, and we are very thankful to them for their generosity. They essentially, they're supporting this essentially testing for folks who have melanoma and a concern for cancer in the family. All right, this registry involves free genetic testing, so there's no worry about a copay or getting billed around the back, and you guys know how medicine works. And there's free genetic counseling, okay? And this is in exchange for a few extra tubes of blood for our scientists, all right? And what we're trying to do with this is essentially see how familial melanoma is. We got our first initial results. I can't tell you about them because they're not released until next week. They're going to be presented at our big National Oncology Conference. So we're very proud of this work. But what we can tell you is, just don't tell anyone. What we can tell you is there's a higher than expected percentage of people in this category, 2 or more melanomas in the family, melanoma and other cancers in the family. There's a higher than expected percentage that that were positive for being carriers of something inherited. And some of those were in genes we already know to be in melanoma, and some of them were in genes we don't yet know to be related to melanoma, but we know are related to cancer. So this is actually going to be we'll learn more. We'll learn more. And for those of you in the room who have participated, thank you from the bottom of our hearts. So what to know, all right? This is the summary of it all. So some melanomas do run in families. Some are from sun, some are from genes. Sun exposure does seem to make it worse, okay? Knowing about a familial risk of cancer can help catch cancer early and potentially save lives. If there are multiple melanomas in a person or melanomas run in a family or multiple cancers, consider talking to genetic counselors or asking your doctor about genetic counseling, okay? They are a fantastic source of information. All right, for all the mothers in the room.